Hi and welcome. I'm trying to learn medicine today, Anoxia, and after we've done it, we're going to do Extensor, Carpi, Ulnaris strength training. And if you're participating in the Extensor, Carpi, Ulnaris strength training, dann ist man mit dir auch. Now, but first, Anoxia. Anoxia is, and this is no medical advice, we're talking about the blood system and internal anatomy, and this is no medical advice. Anoxia is an insufficient supply of oxygen to the tissues of the body. In anemic anoxia, the reduction in the supply of oxygen to the tissue is caused by deficiencies in the constituents of blood. There may be a shortage of red oxygen-carrying blood cells or a fall in the chemical makeup of hemoglobin. We had anemia in quite some parts already, but that was not mentioned. We had iron deficiency anemia, there was not enough iron. We had pernicious anemia, there was not the enzyme to get vitamin B12 out of food to make the hemoglobin. And we had sickle cell anemia, where the hemoglobin was deformed, and if a person was making sport or something, when the cells was deformed, would be then attacked by the autoimmune or by the immune or by the body, and therefore destroyed. And now we are not enough hemoglobin to transport oxygen. And we had megaloblastic anemia, there were fatty acids missing, folic acids were missing. Now, and we have now anemic anoxia. That is just any type of anoxia which is caused because there's some problem with production of the hemoglobin. I think we can say that. Okay. Sometimes anoxia is said to be stagnant, in which case it is the result of general or localized stagnation of circulating blood. Stagnant, in which case it is the result of general or localized slowing of circulating blood. Okay, there can be anemic, is it anemic? Anemic anoxia, that is when anoxia caused through a deficiency in the hemoglobin cells, which are normally transporting the oxygen to the body. There can be stagnant anoxia, where for some reason in the circulation of the blood is slower. It is more stagnant. What was it? It is the result of general or localized slowing of circulating blood. I think, as I said, it would be okay. Stagnant anoxia may be caused by problems such as heart failure, shock, the blockage of a blood, shock, blockage of a blood vessel in thrombosis, or a spasm of the muscular wall of a blood vessel. The muscular wall of a blood vessel can have a spasm. Is there a type of disease or disorder by which people have it permanently? Okay, stagnant anoxia can be caused through heart failure, shock, blockage of a blood vessel through a thrombosis, or a spasm in the muscular wall of a blood vessel. Okay, deficiencies in the respiratory system may also cause anoxia, and in this case, anoxia is just again the thing is with anemia. There is iron deficiency anemia, but not every anemia is iron deficiency anemia. And there is iron deficiency, but not every iron deficiency is iron deficiency anemia. And now we have anoxia. Anoxia can be because there are not enough hemoglobin transporting the oxygen, but it can be also a problem of the lungs, not having enough oxygen. Now, deficiencies in the respiratory system may also cause anoxia, and in this case, your condition is known as anoxic anoxia. Anoxic anoxia. Okay, we're having anemic anoxia. We have hemoglobin missing. We're having anoxic anoxia, where the oxygen is for some reason missing in the respiratory system. And the other thing was stagnant, where circulation is close. There can be heart failure or the muscles of the blood vessels are cramping, and we have, I'm going to get back on it, and we're having shock in one other one. Thrombosis, blockage of the blood vessel through thrombosis, and the other thing was spasm of the muscular wall. What's the difference? Spasm. Maybe we're going to come to it. Spasm. Okay, deficiencies can be called anoxia. Sufferers from chronic bronchitis, for example, often have a degree of anoxia because the amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced. Okay, let's look if you're able to say the explanation. The amount of lung tissue available for the exchange of oxygen and carbon dioxide is reduced. Okay, people who have chronic bronchitis may also have anoxia because the amount of lung tissue available to make the oxygen carbon dioxide exchange. To make the oxygen and carbon dioxide exchange. Possibly is reduced. Anoxia may also be caused by an asthmatic attack. Would that be shock? For an asthmatic attack, where the airways are constricted, or by weakness or disease from muscles that are used in breathing. Okay, two more things. It can be also part of an asthmatic attack, because the airways are constricted. It can be caused by an asthmatic attack because the airways are restricted, and it can be because the muscles necessary for doing the breathing are constricted or weak. Okay, because they're weak. Or disease of the muscles or weakness. More rarely, the condition may be a result of reduced oxygen content of the air that is breathed as at high altitudes. I think I heard, because I just thought of it, that there are some type of toxins which can cause the breathing muscle to not work. Some snake poisons too. Okay, we have it all together. This is part 2. Let's try to do the presentation. We having anoxia, that is insufficient oxygen supply to parts of the body. There's anemic anoxia, there's not enough hemoglobin. There is a stagnant anoxia, where for some reason the circulation is not properly running. It can be partly over the whole body. It can be general or localized. It can be through heart failure, shock, spasm of muscular walls of a blood vessel, thrombosis, blockage through thrombosis, blockage of a blood vessel through thrombosis. Other reasons are the anoxia, that the respiratory system is not getting enough oxygen. That can be because a person has a disease or weakness of the breathing muscular muscles. It can be because a person is in high altitude, on high mountains, there is not enough air. It can be because a person has an asthmatic attack, and then the airways are restricted, and people with bronchitis can have it. If it's one or two things too much to remember all to list on. But how about we just try it? I'm going to start the second camera. Anoxia. Anoxia is insufficient oxygen supply to a part of the body. It can be anemic anoxia. The reason is that there's not enough hemoglobin or functioning hemoglobin which would transport the oxygen to the body. There can be stagnant anoxia, where for some reason, generally or localized, the circulation is slowed down, not running properly. And that can be because of heart failure or thrombosis in the blood vessel, or shock or spasm in the muscular walls of the blood vessels. It can be also part of an asthmatic attack where the airways are constricted, that is when anoxia. So anoxia, there's not enough oxygen through the respiratory system for some reason, which could be an asthmatic attack where the airways are restricted. It can be also because a person is at high altitude on a mountain, there's not enough oxygen in the air. It can be also a part of bronchitis, people who have chronic bronchitis, because when the amount of lung tissue available to make the oxygen carbon dioxide exchange is not enough available of it. And that is according to Keith Hodgkin's Family Medical Advisor book, page 76. Now, what did I forget? Weakness, disease or weakness of the muscles. I have just time for one more take. I'm not going to do it. I'm going to stop the camera. And that was the medical part. That means we have to keep that one thing in our brain that it can be disease or weakness of muscles during the breathing, of the diaphragm or something. Where I said there's snake poisons, I think snake toxins, which can affect that. These muscles don't work. Anyway, and then the person suffocates. Now that was the hepatology part. That was the medicine part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the Extensor, Carpi, Ulnaris strength training, then it's with the we're having a good sit stand, always with these exercises. We're having the arms next to us, hands front to fists, and we're bringing the fists down. If you participate in the arms, and we're bringing the fists down, and again down. A flat gait, hold it a bit, and again down. We have 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. We're not pushing anything. And the third rule is, for the next exercise, we're having now again fists, counterfight money check, and bring them up, and again down. Now the third rule is, we do not overdoing it. We just want to strengthen, not to exhaust. And now to the next exercise. I'm using a sock, you can also use a sock. Now, press with moderate good force onto the sock or whatever, or t-shirt or whatever, and bring the fist down. And again up. And try to bring it higher the whole time. So just bring it there, so bring it higher. And press with the whole hand evenly, with the 4th and 5th finger as well. And last time up. And on the other side. Press with moderate good force and bring the fist. Again down. And again down. And now the next exercise. Press again with good force and turn the hand to the outside. With all 5 fingers evenly pressing and to the inside. Only as far as it goes, but bring it so far. Now with the other hand, press again with good force and bring it to the inside. To the outside. Again to the inside. Let's do it one more time. And when I'm just thinking about it, the hand getting white and pressing. What about the bed? Now, and when the last exercise, just press with one more in that position, and bring the hand down, and again up. Blockage of the glasses, but not forward. And again. And on the other side, press again and bring it down. And again down. And one more time. And now press just in neutral position. And on the other side. And last exercise, the floor. Just go with moderate force over the middle part of the floor. And on the other side. That was the Extensor Carpi Ulnaris strength training. I thank you very much, and until next time.